Hi guys, today we're going to be going over dysphasia and aphasia. Aphasia literally means without speech. So some characteristics you'll see in students with aphasia are that they may have difficulty understanding what is said to them. They may have a difficult time writing if they cannot think of the right word. Lots of them will get stuck up on thinking of something that they know but they don't know how to say it, and then they also may say the wrong word when speaking. So they might be saying something that's completely literate, but then just a random word comes out of their mouth that doesn't make sense with the rest of what they're saying. Some characteristics for dysphasia is having a hard time remembering faces or people. They might not understand what you're saying or what you're trying to tell them to do. They might put words in a sentence in the wrong order, so the verb might be in the wrong place. And they may have a hard time speaking in front of people or at any time, because people with dysphasia have a hard time communicating, so it might be hard for them to speak in general. Some common causes for aphasia or dysphagia are having a stroke or brain trauma. That's the most common cause. This damages the language center and also causes digression in the language center of the brain. So people with aphasia, basically their language center isn't working properly, so they're not able to form or understand language. Brain tumors and infections can also cause aphasia by having a buildup of a tumor next to where the language center is. Doctors diagnose aphasia by testing when checking for brain trauma. They also use neurological tests by asking the patients questions, and then they ask patients different names or objects of things to test if they have aphasia, and this will show if they have memory loss or if they just can't really understand what the doctor is saying. And these tests also help to show how strongly aphasia is present in the brain, so they can tell if it's a strong case or if it's kind of a milder case. Some treatments for dysphagia are taking out the brain tumor if that's what's causing the disease. Also, going to a speech pathologist is a really good way for people to get treated with aphasia, because they're able to work on their communication and understanding of other people. Transcranial magnetic stimulation is also used because they actually stimulate the parts of the brain, which is generally the language centers that are affected, in order to try and get them working properly. Some classroom challenges that your students might have are reading, because they may not be able to get through as much reading as other people in class. Writing can also be a big struggle for those with aphasia and dysphagia, because they may be putting words in the wrong places in sentences. They also may have a hard time socializing because they're not able to communicate everything that they want to say to people, and sometimes other students may think that they're awkward or just odd because they can't phrase what they're trying to say. It goes along with that is that students may struggle with displaying their thoughts in words, so that would cause them to have a hard time socializing because they're not able to display what they are thinking. Some teacher accommodations are extending the time for a student to take a test or even to complete assignments, using different fonts or formats that might be easier to read for the students. Also, not giving as much reading and writing homework is a big thing. You can have students explain to you orally how or what they learned in these readings, and that's a good way for them because, well, for those that have a hard time writing, if they can communicate to you by speaking, then that'll be a lot easier for them. It's also good to let the students take breaks when testing, to allow them to not be overwhelmed, and then allowing students to record lecture for notes so that they can listen to it later so that they can try and understand it more. Some assistive technology that I thought was really neat that could be used with this are squiggly keyboards. This keyboard actually allows students to draw what they're trying to say. So they can just use their finger and draw on the keyboard an emotion or a feeling, since those can be pretty hard to put into words. Also, the MyScript Stack handwriting keyboard. It's been noticed that people after stroke feel a lot more comfortable writing rather than typing. So this actually allows people to write on it, and then it turns it into actual type. So you write on it with your finger or with a pen, and then it changes it into text. And finally, the wordboard keyboard. I thought this one was the most interesting. It stores common phrases that can be used for people that struggle with memory and language. So those are already pre-prepared. And that is it. Otherwise, these are my sources that you can look into, and if you're interested in finding more about it, these are really good sources. Have a good day.